The patient presented with left knee pain that began during a squatting to standing motion, accompanied by a popping sensation. Preoperative MRI revealed a bucket handle tear of the medial meniscus. On the coronal view, the displaced meniscal fragment was noted within the intercondylar notch. The sagittal view demonstrated the characteristic double PCL sign. Pass a suture through the inner segment of the bucket handle tear using a scorpion suture passer. Then, insert a specialized needle from outside the joint. Retrieve the suture limbs sequentially, first the femoral side limb, followed by the tibial side limb. Tie both limbs extracapsularly to anatomically reduce the meniscus. For the anterior portion of the tear, complete the repair using an outside-in technique. Carefully pass the specialized needle, preloaded with a suture loop at the proximal end of the groove, through the inner portion of the meniscal tear. Then, gently withdraw the needle, taking care to maintain the loop in place without displacing it. Reinsert the needle into the outer segment and hook the suture limb onto the distal end of the groove. Gently retrieve the suture limb and tie it through a small incision at the external capsule.